Let's talk a little bit about that on the interventional pain side for treating people that are suffering from neuropathy.
Using spinal cord stimulators. I had several patients that I'd done these for neuropathy pain, and they were getting great results. It's important to offer your patients hope, have an answer for them, be willing to do something for them, just being able to offer them something different that's not an opiate or not a pill, offering something that can maybe give them long-term relief. That's important.
I think it's really important to go into that because we see so many patients that are literally at their wit's end.
Yeah.
They're at the end of the rope, they're at the end of the line, they've been to their primary care, they've been to their neurologist, and they're not getting real help. Or worse, a lot of these doctors have told them, well, there's just nothing that can be done. From your role and experience in training, what have you seen that is the most effective at treating neuropathy?
The stimulators, I think, are probably the best option right now for what we have in terms of treating neuropathy, nerve pain. It's a super interesting therapy, and it's been around since the 60s. A lot of people don't know that.
Wow, I didn't know that.
Yeah, the first case was done, I think, is in '67. It was a guy who had a lung cancer and was, I think, basically on palliative care. His pain was uncontrolled on all kinds of, I think, narcotic medications. Well, they put a stimulator lead up and stimulated that, and he got like amazing pain relief like quickly. And I don't think he lived a whole lot longer, but it provided good pain relief for him for the rest of his life. I think within a year or two it was FDA approved, which is really crazy for something to go from the very first time it's being used to being FDA approved within a year or two.
So can you speak to a little bit, because it's got a very aggressive name,
Yeah.
spinal cord
Yeah.
stimulator. So how invasive is this?
So I explain it to patients like this. When women are in labor and they get a labor epidural, what we do is we use a needle. You sit up on the side of the bed, we clean off your back with soap, we just don't use an x-ray camera or anything, we just kind of use landmarks. We put a needle into the epidural space, and then we put a catheter in. A catheter is just like, think of like a little hose or a little tube. Okay, and we infuse medication through that. And that medicine will make you, numb, and your legs are kind of weak, and so you can deliver the baby and not be in terrible pain. So the stimulator procedure is, it's very similar to that, but we take all these safety precautions. A lot of times we'll get an MRI first of your back to make sure that everything looks okay. We use an x-ray camera while we're doing it. A lot of times you have sedation on board to make sure that you're comfortable and not too anxious during the procedure. So, and it doesn't really take all that long. I find that most of mine are done within 15 or 20 minutes. And most of the time patients aren't any more uncomfortable than they are when we do a regular epidural or some of our other like less invasive procedures. You got to respect that we are working around the spine and the spinal cord.
Yep.
And so you got to be careful. You got to know what you're doing. Like a bleeding risk is probably 1 in 200,000 versus maybe 1 in 50,000 to 1 in 10,000. Someone who's older and maybe they're on blood thinners or something like that. But the risks of those are incredibly low. We put you on antibiotics during the trial just to prevent any sort of infection, totally prophylactic. And people always want to ask about stuff like, am I going to be paralyzed? Am I going to have nerve damage? But I think that risk is incredibly low. I think if you were to have a serious problem with like nerve damage or something, it would probably be a result of a bleeding problem or an infection in my mind. From the procedure itself, I think is pretty uncommon. Pretty minimal. Yeah.
So the whole thing's pretty minimally invasive.
Very minimally invasive.
So walk me through.
I don't even use an incision. We numb up the area with numbing medicine. I don't even make an incision. We put the needle in through the skin.
So it sounds very similar to like the trial's very similar to like an epidural type.
Correct. Very, very, very similar. The only difference is instead of injecting medications, we're putting a wire in. Yeah.
I got it.
Yep.
Okay.
Yep.
And so how long is that trial typically?
Trials are usually 7 days. We want to give the patient enough time to really experience it.
And how long is the procedure?
Procedure's like 15 or 20 minutes typically.
That's really fast.
Yeah.
Okay. So 15 or 20 minutes, we don't have to use full anesthesia?
No, we just give a little sedation. So there are patients who don't want sedation for it, understandably so. But most people we give a little bit of, you're not going to go all the way to sleep, but we say it's going to help you relax a little bit during the procedure. We try to keep you awake, and part of the reason we keep you awake is there's safety built into keeping you awake. Because if my needle is or my wire is somewhere that it shouldn't be in your spine, you're going to tell me when you're awake versus when you're asleep. Then you wake up and all of a sudden, I have this terrible pain in my leg, or I can't move my foot or whatever. So keeping you awake has an element of built-in safety there for us as well.
How do you judge whether or not the trial is successful? Is that on you? Is that on the patient?
It's all the patient. People sometimes, I think, misunderstand the trial. Basically, it is an opportunity for you to experience what this therapy will be like if you have it implanted. I try to use the analogy of like you're taking a car for a test drive, right? Like if you're driving the car down the street and it's making all kinds of noises and blowing smoke and whatever, and brake, you're probably not going to buy that car, right?
Right.
So this is your test drive for your stimulator. You get to take this and keep it for a week, and you get to see if it meets your needs. We like to see at least 50% improvement.
So you get to try it before you buy it.
Try it before you buy it.
That's good.
I think there are patients who come back and say, yeah, my pain's 50% better, but I'm walking more, I'm sleeping better, I feel better mentally, I'm taking less medicine. So you take all those things, those are things that you can't like quantify all the time, right? Even though maybe it's 50% pain relief, like I'm so much better in all these other things. I'm not using my walker, my cane, I can walk around. I cleaned my kitchen for the first time in a year. That's not a small thing for someone. And I think someone who's been dealing with pain, chronic pain, 50% is huge.